Have you ever wondered why your skin is scaly, itchy, with rashes and dry patches? Not to worry, we would find out why this condition known as psoriasis affects over 125 million persons in the world on this episode of Sound Health. Good evening, welcome. I am Olasumbo Modupe. The conversation begins after this break. Please stay tuned.
We are now in a situation where health is directly targeted in so many conflicts. There's been such a deterioration in overall respect by many, many, many countries for the basic safety of health workers and the basic security of health facilities that it has now become commonplace. It's become part of the normal architecture of war, and that angers me. We all need to take a step back. We continue to show the world how many facilities are there, how many patients are in those facilities, where those facilities are. Everybody knows where they are. All sides in the conflict know where they are. All sides in the conflict know that there are patients and health workers in those complexes. So there is no excuse on any side. The rules are clear. It is the responsibility of all parties in conflict to directly assure that their conflict and their actions, whether directed at others, do not include or engulf a healthcare facility. They're specifically directed in their plans to identify and avoid such outcomes. So the fact that you didn't mean it or the fact that it was an accident doesn't count. You must guarantee and seek to guarantee that no such outcome can occur. It must stop.
Joining us via Zoom this evening is Dr. Ayesha Akinkugbe, Senior Lecturer with the College of Medicine, University of Lagos, and Consultant Dermatologist, Lagos University Teaching Hospital, and she is going to share her expertise on psoriasis. Good evening, Dr. Akinkugbe, and thanks for joining us once again on Sound Health.
You're welcome. Good evening.
All right, Dr. Akinkugbe, the World Health Organization says about 125 million persons in the world are living with psoriasis condition.
So psoriasis can be explained to be an immune-mediated disorder that occurs when your immune cells, which are also known as the T lymphocytes or the T cells, attack the healthy skin cells in the body. It doesn't only affect the skin, it can affect the hair and the nails. Okay. So you have lesions that appear in all these areas. Now, for some individuals, it can be the scalp only, some can be the skin, and then some of them can have a bit of everything. It also affects the joints. It's a condition that there is no predilection for sex. It commonly affects those between 10 and 40 years, but you should watch out, in other ages as well. It's not exclusive. It is not contagious. And it is a condition whereby, when you have widespread psoriatic lesions, it can look quite terrible, and it can also be stigmatizing, self-stigmatizing, and then even from the point of view of others. Now, what causes it exactly is not known. There are several triggers. You could have infections, you could have allergies, you could have food-related triggers. Stress is very important. Alcohol can play a part as well. So the individual gets their psoriasis triggered by certain things. There are environmental and genetic factors that are implicated. So an individual who is prone, they can now have a flare when they have an infection like malaria, could also be a viral illness. Taking a vaccination as well could trigger your psoriasis.
All right, Dr. Akinkugbe, tell us what are the symptoms to look out for, because you can tell that you have acne by, just pimples and some other key symptoms. What are the symptoms of psoriasis?
Okay, so basically what you would have is a raised lesion. So it's a lesion that you can feel. That's what we call a plaque. You would find it on any part of the body. It's usually, like in the Caucasians, it's described as an erythematous, which is a reddened rash. Now, obviously, in the skin of color, we are all of various shades of brown. Sometimes it's not so obviously red. It could be darker, what we call violaceous, and it could also sort of appear relatively gray. But the most important thing is that there's scaling over that lesion. So what happens in psoriasis is that the immune cells affect the cell turnover. Normally, the turnover of a skin cell is 28 days. But in psoriasis, this is destroyed and accelerated. So your shedding is every 3 to 5 days. And sometimes you have people who are coming to the clinic and they'll show you like an envelope or bag where they've collected all the shedding cells. You know, when they walk around their room or in their bed, there's shedding. So there's an increased scaling. So if you have a scaly rash that has not gone away after 2 to 3 attempts at treating it, then you can ask your doctor, could this be psoriasis, or ask to see a dermatologist. For the nails can be damaged. So they look very dystrophic, the nail architecture is destroyed. And the scalp. Now for me, the scalp is one that is actually mismanaged and missed or misdiagnosed, because the average individual will go to the salon to complain about their hair problems. That needs to stop. The hair, the skin, and the nails are part of the purview of the dermatologist. So any lesion on the hair and the scalp, see a dermatologist. So a lot of people will tell you, oh, my dandruff, it's been falling. I've had it since I was in secondary school. And you just ask one little question that, you know, when you scratch it, do you see some little spots of blood? And they say yes. Same thing can apply on the skin. That is almost like a giveaway for psoriasis. You have these bleeding spots. So I think the main thing is that, you know, it does affect the hair, the skin, and the nails and the joints.
Okay, thanks for letting us know the types now. So I want to quickly ask, when you mentioned the fact that it affects our hair, I would also like to know, does this lead to, let's say, alopecia, you know, and other hair condition?
So yes, it affects the scalp, and it can lead to alopecia because that area is diseased, the hair loss, you know, appears there. However, if it is quickly identified and with prompt treatment, the hair loss will be reversed, because you want to get to it before it gets to a scarred stage. And with psoriasis, the hair loss is not typically scarring, so the prognosis is good.
Okay, it's a good thing you said it is not, psoriasis is not contagious. Can it be hygiene related?
Not at all, not at all. Remember I said that it's your skin cells that turn against you and cause an increase in the proliferation of the skin cells that are formed. So you're just shedding. So it's an immune-mediated thing. There is the environment and the genetic factors that play a role in any individual, but it is not contagious. You cannot catch it, but you could have a family history of psoriasis.
Okay, does the skin pigmentation matters now when it comes to psoriasis?
I'm not sure I understand your question.
Our complexion, let's say a light-skinned person could be more at risk of psoriasis.
Not at all, not at all.
All right, Dr. Akinkugbe, thanks for that clarification. So who is more at risk of psoriasis?
There's equal sexes, so it's equally affected in both sexes. Those who have a genetic predisposition are the only ones who would be more likely to be predisposed to psoriasis.
Okay, Dr. Akinkugbe, can this disease be cured? Are there treatment options?
Yes, there are treatment options. The first thing is to make a diagnosis. Most of the dermatologists would almost make a diagnosis clinically, but you need to confirm this by doing a biopsy, a skin biopsy, which means you just take a small sample of the skin and you subject it to the histology so that you can have a histological diagnosis. Then you can now start treatment. Treatment, first of all, is obviously with the skin care, using the right kind of products on the skin. You want to use emollients because of the increased cell turnover and scaling. You also want to use topical corticosteroids, which will help the inflammation. You also can use calcipotriol and some other vitamin D analog agents. And then you want to start what we call systemic treatment. Now, systemic treatment, you need to use drugs that are called disease-modifying medications. And then this would include methotrexate. You can use Cellcept, which is mycophenolate mofetil, and then you can use biologics. Biologics are the way to go. It's very expensive, but it is available here. And when you have severe forms of psoriasis, you would really want to go for the biologic treatment. This is where you're using antibodies against the body, and it's injected, monthly, twice monthly, and this has a very good prognosis, but it is expensive, but it's available here. Now, remember that I mentioned there are different types of psoriasis. So you can have the chronic plaque type, you can have gutted psoriasis, you can have inverse psoriasis, you can have genital psoriasis as well. So there are different forms, of psoriasis, and it depends on the extent of the psoriasis. And in that way, we can now take a plan for your management depending on the extent and severity.
All right, does the use of harmful skin products and predisposes one to psoriasis?
No, but as I mentioned, I had already highlighted what the causes are and what makes you predisposed to it as genetics. However, harmful products on the skin can harm the lesions and make them worse. Like, for instance, the ingestion and topical application of agbo, which is quite common in our environment. This can cause photosensitivity, can cause an allergic reaction, an irritant reaction, and so the underlying psoriatic lesion, just like other skin lesions, would now be worsened.
Okay, Dr. Akinkugbe, earlier in your response, you mentioned environmental factors could contribute to psoriasis. Can you be more specific? Could it be exposure to sun? Can you be much specific now?
So as it is, there are no confirming factors that say, what part of the environment. There's still a lot of climate change and things like that are affecting the environment. So the sun can be protective and at the same time can also be damaging. So that also plays a part. Carbon in the air, the type of air that you have around you. These are other things that, are known to affect various skin diseases, not just psoriasis. So the environment as a whole has been noted to be implicated in psoriasis, sorry.
Okay, your call to action now as we wrap up, Dr. Akinkugbe.
The call to action would be, if an individual has a scaly skin lesion affecting the hair, the scalp, the skin, that has not gone away despite treatment by a general practitioner or any other person or themselves, they should ask to see a dermatologist. That would be the key message to take away. The other thing would be, we need to stop the application of or self-treatment of lesions by going to a chemist or a pharmacy and buying all sorts of things, trying to treat something that you don't know what it is. I would say that if at all you have tried something once and it hasn't worked, ask to see a dermatologist. There are a lot of dermatologists in Lagos. We are growing, and in other parts of the country. Ask to see a dermatologist.
Okay, your skin is all you have. It is the largest part of our body. Ensure you protect, safeguard your skin jealously. Dr. Ayesha Akinkugbe, Senior Lecturer, College of Medicine, University of Lagos, and Consultant Dermatologist, Lagos University Teaching Hospital. Thank you so much for your time on Sound Health.
You're welcome. Thank you for having me.
All right, that was Dr. Ayesha Akinkugbe on how to manage and treat psoriasis. Sound Health continues with trending health report from around the world. Please stay tuned. All right, you're still watching Sound Health on Lagos Television. More to come in a moment. Well, this is where we say thank you on today's episode of Sound Health. Remember, your skin is your precious stone. Your skin is the largest part of your body. You need to safeguard and protect it at all costs. If you are experiencing any skin condition, visit the dermatologist as soon as possible. You do not need to self-medicate. For comments and inquiries, or you have topics you would like us to treat, send SMS to 0035826603 or follow us on social media at LCV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.